for COVID-19. This dramatic rise in hospitalizations forcing Intermountain Healthcare to take what they call drastic action to protect public health. Starting next week, they will postpone non-urgent surgeries at several hospitals across the state, including Intermountain Medical Center in Murray. That's where we find ABC4's Haley Hendricks tonight. And Haley, this is big news. What are you learning about it?
Well, Glenn, this action will delay hundreds of surgeries for people in pain. And officials say, well, it's not something they want to do. It's something they had to do with a shortage of beds and staff.
Our epidemiologic projections suggest that we're not even at the worst part yet.
Intermountain Healthcare models predict in the near future, its hospitals will need 40 more intensive care unit beds and about 70 more general medical.
And guess what? We just don't have them.
Intermountain Healthcare President Mark Harrison says COVID-19 patients, many who are unvaccinated, currently take up half of Intermountain hospital beds in the state, and there's not enough caretakers. He says the situation is becoming dire.
Having folks who've chosen to not be vaccinated, we're seeing implications to our public health.
Now, 13 hospitals ranging from Logan to St. George will begin pausing non-urgent surgeries September 15th.
The surgical cases we're going to pause are not minor procedures that are trivial, that are purely elective. These are urgent, but not immediately life-threatening cases.
And Harrison says this pause will affect many Utahns.
You are going to get to wait for that procedure because we don't have a bed, because it is filled with an unvaccinated person with COVID.
Harrison says he hopes those who have not yet been vaccinated will choose to get the shot and be a part of the solution rather than the problem. Now, this action will begin next week and it will go into the foreseeable future. Reporting live in Murray, Haley Hendricks, ABC4 News.
For me personally, September